There is a carnivore aspect to this story. I just had my 2-year carniversary, and it was not at all what I had expected. As I was approaching the 2-year mark, which was September 24th, 2024, I knew I was losing weight, I was getting close to my weight loss goal, and I was pretty confident that when that date came, I was gonna have hit my weight loss goal. So I was mentally imagining me getting on here and telling you about it and throwing confetti and just being so excited and yay, up with carnivore. And then this happened. I woke up one morning, opened my eyes, and my right eye, when I looked out, there was a weird spot in my vision. Fortunately, I already had an eye doctor appointment coming up. So I went to the doctor and they did their imaging and told me I had a macular hole. I was then referred to an ophthalmologist who is a physician who specializes in eye surgery, and this ophthalmologist specifically specialized in retina surgery, and discovered that a macular hole is when, realize this is a dentist talking about an eye thing, so bear with me. In your eyeball, there's gel. It's called vitreous gel, and it is encased in a sac called the vitreous membrane. So imagine like a balloon full of gel, and that gel is very, very sticky. And the membrane is sticky because the gel is sticky, and it's all sticky and it's all stuck to the inside walls of your eye. But then as we age, that gel becomes less sticky and more watery. And the membrane, the balloon part, becomes less sticky, and it starts to peel away from the wall, the inner wall of the eyeball. And for most people, 80% of people, this happens and they don't even know that it happened. There is no problem, no pain, no eyesight issues, nothing. But for 20% of the people, as that membrane is peeling away from the retina, it can cause a tear. If the tear is on the outer sides, then you lose sight in your peripheral vision. But if it's in the center, and in the center of the retina is this little circular area called the macula, and the macula is responsible for your central vision. So when I would look out, right in the center of my vision, there was this weird spot where it looked like the picture was kind of caving in on itself. That's because that vitreous membrane had torn a little hole in that macula, and I couldn't see. The cells were not there for me to see. And what can happen as it progresses, because that membrane is still tearing, as it tears, the hole can become bigger and bigger, and you can lose more and more of your vision. If you do nothing, it's very likely that if I had done nothing, it's very likely that I would have gone legally blind in my right eye. There is a treatment, and the surgeon explained the treatment. It's called a vitrectomy surgery, and what she would need to do is get my eye numb, go in with instruments inside my eyeball, suck out all that gel, take instruments and finish cutting away the membrane so it stops tearing at the hole and it gets completely released, and then insert a gas bubble. Now the gas bubble, its job is to push against the retina, and hopefully that pressure will cause those cells to knit back together. Now, in order for that to work, I had after my surgery, be in a head down position, which is like this, for the rest of the day of the surgery, plus 5 more days. I had to sleep with my head down. I had to walk around with my head down. I had to keep my head down. Now, the research shows that you can do that for 50 minutes and then put your head up for 10 minutes, and it doesn't really affect the results. So that's what I did for 5 days. I set a timer on my phone for 50 minutes, and then when the alarm went off, I set one for 10 minutes. And then when the alarm went off, I went back and forth, head down for 50, head up for 10. Now, they tell you about this surgery, but there's a caveat. There is no guarantee that this surgery will work. The best that you can really hope for is that you're going to save what vision you have left. That it's pretty likely that, in theory, your eyesight won't get worse. Now, in theory too, it can get 100% better. But it may not. So there's no guarantee. And when you listen to what this surgery entails, I was just like, no, thank you. I don't want to do this. But really, you don't have a choice, because I also didn't want to go blind at my right eye. Now, bear with me. There is a carnivore aspect to this story. And the reason I think it's important that I tell you about it is because it does affect 20% of the population. And you may be one of these people who are facing this surgery, and it sounds very daunting. But as everything else, the reality of it is not as bad as how it sounds. Of course, Better Life Through Chemistry, they give you all the drugs that you need to be able to deal with it. And it is really quite a fascinating journey. So I did the surgery on, guess what day? Tuesday, September 24th, my 2-year carniversary. Here is the carnivore part of all. At the surgery center, part of the surgery is they gave me fluids. And in the fluids is dextrose. So once I recovered from the anesthesia and I was kind of feeling normal, I started having incredible sugar cravings. Now, I have not had sugar cravings for almost 2 years. I had bad sugar cravings when I first started the carnivore diet, and for about 2 months, maybe a month really bad. The second month was kind of like, oh, I'd rather have some sugar than not. And then after that, they were gone. I didn't have it anymore. All of a sudden, my body was so craving sugar. So what I did was what I had done originally to get myself off of sugar, is that I started eating cheese again. And I ate cheese, and I had hit my weight loss goal. I was really excited about that. So far, the cheese hasn't bothered me. I'm about to get off the cheese now, though, because once you start eating it, you're like, oh, yum, I like this. But I am going to stop again. But it did get me through the sugar cravings. I have not gained weight, so yay, that's great. The other part of it is the doctor told me that it would be 4 to 6 weeks for my healing. Now, when I listened to other people's story online, they were saying no, it was more like 8 to 10 to 12 weeks of healing. Also, here's an important point. The gas bubble, when the gas bubble is in your eye, you can't see through the gas. So 24 hours after the surgery, they took my bandage off. And when I looked through my eye, all I could see was light and shadow. I mean, it was so bad that if there was a window in front of me, all I could see was the light. Like, I could not tell that it was a window. I could just see the light. And of course, I knew it was a window, but I wouldn't have been able to have known it without already have knowing it. Okay, so that's how obstructed your vision is. And that's probably the most disturbing thing, or it was for me. So what happens is that as time goes by, your body reabsorbs that gas. And as that gas bubble gets smaller and smaller and smaller, you start to get your vision back. Just a little bit, it's from the top down, you start to get your vision. It's like the picture starts to appear. So you can see the top part of your vision for a while, and then it just gets bigger and bigger and bigger. And as the gas bubble gets smaller and more of your vision comes back, the gas bubble is getting smaller also in diameter. So you start seeing this round bubble bouncing around in your eye. That is a little disturbing. And that kind of sometimes gave me a little bit of motion sickness too. If I was trying to do something, like I couldn't read very much or anything like that, because that bubble moving around just kind of made me feel a little like, woo. But then as you're getting more and more of your vision back, it comes faster. Once you start to get, like I couldn't see at all out of my right eye for 9 days. And then at day 9, I could see enough out of my right eye where I felt more comfortable. And then after that, it just kept coming back really fast. So a week later, I could see completely again. Now, for me, my healing took 2.5 weeks. Way faster. They also tell you that you will, by the time you can see, you're going to have a cataract form. So far, I have not had a cataract form. I'm pretty much good. And it's been, on Tuesday, it will be 3 weeks. No, last Tuesday was 3 weeks to my surgery, but I went to work on Monday. So the 3 weeks prior, that was my last day of work before my surgery. 3 weeks later, I was back at work. Now, to me, that is a miracle, and I give credit to the carnivore diet because my inflammation is low or non-existent, and it just allowed my body to do what it needed to do to heal my eye. It's a great commercial for carnivore as far as I'm concerned. Anyway, I hope you never have to have this surgery, but if you do, it's not as bad as you're going to think. And it does have a 95% success rate, and I'm now part of that success. I hope you found this useful. Please leave me a comment if you have any questions about the surgery, or if you just want to know more that I didn't cover. I do want to encourage you that the carnivore diet puts your body in a really great position to heal if you ever have a health challenge. So go out, eat some meat, and have a great life.